of my biggest hobbies I love to do. I love to surf. And the reason why I love to surf is because I love telling people who say, you can't surf. Yeah, I can. You know, and I have PD and I can surf. What's up with that? So, fishing's a big thing for me. And it was also a big thing for me back in 1999, 98, 99, when I went against the mailman. I just want to go back before I show this slide to let everybody know that there's some people in the league that you battle. There's some people that you battle. And I battled Carl, but I had a good time doing it. He's always been somebody I've tried to pattern my game after. And so when I was diagnosed, he was the last person I thought would call. He was the first one. Called and wanted to know what he could do. How could he contribute? How can he help me out and help others like me out? And I said, well, you know, we had that little scuffle where you cut my eye. He goes, oh yeah, but that wasn't nothing. We need more than that. I was like, let's go on the fishing trip that I proposed. And he goes, you send me some dates on there. And I said, I sent him some, well, there we go. There we go. This is after I sent him some dates. Yeah.
And they've gone ahead. Brian Grant strong to the rack over Malone.
Most Trailblazer fans will remember it as the most physical and contentious one-on-one rivalry in the NBA heading into the 21st century.
Grant in great position, cups two hands over the top.
The intensity of Portland and Utah games went through the roof when the big bodies of Brian Grant and Karl Malone collided on the court.
One of the few guys that I knew that he was going to bring it every night, so he brought the best out of me.
There was nobody in the top 10 on my list of players that I'd like to play against.
Even after they retired from basketball, it seemed unlikely these two combatants would ever reach out to the other. Too many flying elbows, too much spilled blood, too much pride to ever hang out. But Brian's life now consists of living with Parkinson's disease and tirelessly working with his foundation to help other people afflicted with the disease. Karl Malone took notice of his old adversary. And so a simple two-day fishing trip to Alaska with 4 other men who were winners at an auction benefiting Brian's foundation brought Grant and Malone together and redefined their relationship forever.
I knew he was an outdoorsman. I'd heard that in several different interviews, but did not know him as a person.
People said, so you going fishing with Brian? I said, yeah. They said, how long you been knowing him? I said, well, I don't.
Kind of surreal up until it happened because I was wondering if it was really going to happen, but I can tell you one thing about Karl Malone, he's a man of his word.
We hit it off. We genuinely like each other. In a short period of time, it became a little brotherhood.
I'm sorry. Hey, don't turn your back on me. Go on and say what I've done. Nothing. Coach me. I'm coachable. I'm coachable.
Talk to me. Nice and easy. Nice and easy. Nice and easy stroke. Right there. He can't even feel that. He cannot even feel. Well, okay, he felt it.
He felt that. I got my legs balanced. I got my legs see how I'm balanced. That's why you worked out all the years. For this moment. Coach me, Brian. You got it. You got him now. Come on. It's like running that fast break. I just at least want to see him. Oh, there he is. Oh, that's a nice one. Son, bring that thing home. Easy, mother. Yeah! Yeah! Look at that. Oh, that's fishy today. There ain't nobody getting that. Hey, Captain, go get the ice bag. We need the ices for him. That's sore. Wow, big. We with you. We're with you from now on, bro. All right, baby. From now on. That's right.
But I really hadn't been the same since I've been here with him. Now I get to help in something a lot bigger than Karl Malone and the Jazz or the Portland Trailblazers. You know, I really feel that I get to help a whole group of people. This trip here has been one of the neatest things I've ever done in my life.
It was great knowing the mailman, you know, as an athlete and as a basketball player, but when he delivered with this, that's a real delivery. The mailman truly delivered.
Brian don't want anybody to feel sorry for him. And that's why I think the world of him, and that's why I'm gonna be there for him. In his fight, I'm in the fight with him. And I'm not behind him, I'm right beside him. We're gonna take every step and see if we can find a cure.
Thank you. Ooh. All righty. The mailman delivered. He definitely delivered. Man of his word, man of his promises. He's done a couple other things for the foundation that he wouldn't want anybody to know. But it really hits you here when somebody like that does something, you know. I would have expected my phone to ring off the hook by several different people. Does that make them bad? No. It just shows that there's people out there that care about you and you don't know it. So, as Pat Riley saying, if you were ever coached by Riley, you get to know his sayings. Excellence is the gradual result of always striving to do better. He's right. Striving to do better no matter what obstacle is in front of you, because I could have let that obstacle of being in a racist situation take away this stuff, but I didn't. And neither can you, you know, especially when it comes to this disease. Let's stay in touch. The Brain Graham Foundation website. And I just want to finish with this. Thank you for your patience with me, and thank you for being here. If you're not someone who has Parkinson's, but you're here because of someone who has it, definitely thank you for that. And that's about it. I have one other thing to say. That is that I would like to donate my fee back to this organization because it's such a wonderful organization. And I told the girls who have been chaperoning me that, I mean, you know how to treat your speakers. It was awesome. I appreciate that. But at the same time, I'd like to turn around and give that back so that we can continue to fight.
Brian asked me earlier if he was sure I wanted him to speak. He's a little under the weather. He has a cold, and he's been struggling really hard with that. And I said, in Nebraska, we love everyone. So thank you from him for his difficulty with speech. He does have a cold right now. I'm going to bring up the speakers, actually anybody from our team that's still here. I got a bunch more questions that we're going to go over, and then I also want to remind you that you have your evaluations in the back of your programs, and it's so important to us that you complete those and give us the positives, the negatives, what you would like better, what was awesome. We really want to hear that. And we will have closing in a few minutes, but I'm going to get some questions, and if there's any more questions, again, what we don't get addressed today, we will get addressed in the Parkinson's Post throughout the next year. Okay, the first one for Dr. Body. With all the drug failures, how does this impact the manufacturer's ability to interest in putting more money or time into possible products?
I think the question is that what incentives do companies have in investing into these drugs for the future? And I think incentive is big. They usually look at the future promises of reward. And I think this is a pretty unfortunately common disease, so there is a large number of people affected by it. That in itself is an incentive for the industry, and I think the future is bright regardless of the failure. Failure is common in drug development. So 9 out of 10 drugs that are studied for development in humans fail to show any significance, and 1 out of 10 reach the market. And that's even more. So out of 100 drugs studied in animals, 10 reach a human trial stage. So it does take a lot of effort, does take long development, a lot of investment, but I think the promise and hope is still there, and there would be incentives to do it.
This is for therapy. How do you decide between LSVT, big, or power?
So Jen and I both are certified in LSVT big. Between the programs, there are a lot of similarities. They were actually developed by the same group of people. Depending on what's available in your area is probably going to be the most appropriate program for you. LSVT big has been around a lot longer, and so there are providers that are there are more providers available to use that program right now. However, the power program definitely has a growing population of providers too. Between the two, I like both of them because they have the same concepts to them. They're going to teach you those high amplitude movements and then teach you how to incorporate them into your daily life.
All right, the next question is for Dr. Bertoni. My father had PD and I have PD. My children are wondering their risks of having PD.
That's a great question, and we get it all the time. You may need testing, and there are ways of getting that testing done through a study, through the Michael J. Fox Foundation, other foundations as well. But I did have a patient whose father had Parkinson's disease, she had Parkinson's disease, and I said, you want to get testing? And the person, she sold her house, left the farm. The lady that lived on the farm after about 5 years got Parkinson's disease. Some things are coincidence, and the only way to know is to get testing. So I think in that case, if you want to, go for it, and then we find situations or studies that are for your type of genetic disorder, and then you can sign up and you can help eradicate that form of Parkinson's by what you do. I hope that answers the question.
this next one, there's several on Botox. What are the long-term negative effects of taking Botox injection 3 to 4 times a year? How is this studied? And again, are there long-term side effects affecting the muscles after Botox? Dr. Torres.
That's a great question. Before I speak, I have to tell Brian that this was an extremely inspiring, beautiful story of love, resilience, hard work, effort. Thank you so much for coming. This was amazing. We really appreciate it. So botulinum toxin drugs have been used for about 25 years in a routine basis. And there are patients that have been receiving this drug for longer than 20 years. The effects of the toxin have been studied in long-term studies, and it has been shown to be very safe for long-term usage. The medication, as it tries to decrease the amount of muscle activity, can produce some atrophy of the muscles that are overworking. So that is the most common long-term effect that we tend to see. But any of the side effects that the toxin produces is completely reversible, meaning that if we stop performing the injections on those muscles, then that muscle atrophy will be completely resolved after a few months. So overall, the studies have shown that the patients continue to get benefit for a long time, and it seems to be very safe.
Another question, either for or actually for Dan or Shamara. My father-in-law had orthostatic hypotension, and our cardiologist used high doses of ibuprofen to help with low blood pressure. Northera wasn't effective, but ibuprofen did work. What do you guys thoughts on that?
I guess you would want to speak with your doctor about that. High doses of ibuprofen or NSAIDs can affect the kidneys, so that's not always something you'd want to just do on your own without talking to your physician. That's great that ibuprofen helped. That's typically not what we observe as a medication that's overly helpful with the orthostatic hypotension, though.
Okay, Dr. Torres, there's lots of questions about CBD, hemp, THC. They're wondering if it helps with sleep, if it has interference with medications, if it's neuroprotective. So we want your thoughts on the CBD, THC, hemp oil.
I guess I'm the one that has the face. This is a very important question, and I think it's important that we reflect upon this for a second. Some people truly believe that vegetables are healthy for you, but we're from Nebraska. So, there's one misconception. Another misconception is to believe that natural products are safer for you. I can mention a number of natural products that can kill you very quickly, like cyanide, like mad wife, like tobacco, right? So not because something is natural, it means that it's safer. And this is very important for you to know. Now, we are extremely interested on the question of marijuana use and its derivatives in Parkinson's disease and in many neurological disorders. And so far, the studies have shown that it might help epilepsy, for example, okay? Now, the studies in Parkinson's have been lacking. We don't have enough studies. Some that we have shown benefit in terms of reduced anxiety. Some small studies have shown that it doesn't do really anything in terms of improving the patient's quality of life. But I always tell my patients the following. I am 100% sure that if you use some marijuana, no matter what disease you have, you're probably gonna feel better. It doesn't mean that it's improving your disease, and it doesn't mean that it's safe for you either. And the last thing I want, apparently we are on camera, so somebody's recording this. Last thing I want is for you guys to go out and say, Dr. Torres said. No, in all honesty, we just need more studies to be able to know if it's safe or not, if it's good or not. And you know, many people are working on this. So what I would encourage you to do is to discuss it with your primary care physician or with your neurologist, because it's not an easy question, and it's one that you need to discuss with your doctor before you start doing anything like that. Thank you.
Thank you. Dr. Body, in your opinion, will a cure for Parkinson's disease be a vaccine to prevent PD or the cell modification through therapy?
My personal liking is for the immune therapy in Parkinson's disease. So if I have to hedge a bet, I'll put money on immune therapy.
One more for you, Danish. How long does it take for Nuplazid to be effective?
So in the study that was done for Nuplazid, they measured the benefit at 6 weeks after starting treatment. If you look at the data collected, which was collected every 2 weeks, there was a start of benefit at the first 2 weeks, but it reached closer to the full benefit at 4 weeks. So if you overinterpret the data from the study, you will say 4 weeks was where it was reaching close to full benefit. But there's no exact study on that question. In my personal experience, I've seen benefits typically start between 2 to 4 weeks after starting it, but as late as 6 weeks.
Anybody can take this one. Does Parkinson's disease cause sundowning? Dr. Merman's gone, so.
Actually, many other things cause sundowning, and Parkinson's disease may be just one of them. One of the problems is if there's a tendency, if you're taking a medication, it may be causing some confusion. Usually it's in the evening that it becomes a problem. Also, you have to look at things like how well you're sleeping at night. Are you sleep deprived? Are you vitamin deprived? Nutrient deprived? So every one of the speakers has an answer to that, because there are many causes of sundowning. And what we mean is some people get confused in the evening, but they're probably going to be confused during the day also. But that's when it hits a lot of people. So it's varying on the person involved and the situation. So you really have to talk to your doctor about what might be the cause for you.
Dr. Hellman, apathy might be an issue for my mom. For me and her primary caregiver, my dad, how hard do we push for her to do things the doctor recommends?
That's tough. You have to tailor it to the person. So apathy is something that's very difficult. It's a loss of interest, a loss of motivation. I would encourage you to try to find ways to motivate her and to encourage her. She will need a lot of reminders, and that she doesn't have that motivation on her own if she has apathy, so she'll need the external motivation. If you could try to do it in kind of a gentle, I guess how much you have to push probably depends on her and what her personality is and what type of person she is. And ask your doctor for help as well. There are some things that we can sometimes do to help, in the times that we see them, although that you do need the day-to-day help with that. So it's really important to do, if you just leave her, she's not gonna get any better. So it's important to keep up with it. But, ask your doctor about maybe some kind of specific recommendations too.
Dr. Torres, my husband has excessive phlegm, coughing, drooling. Is he a candidate for Botox, and is this covered under insurance? What are the first steps to getting this done?
That's a great question. We used to have a lot of drooling in Parkinson's disease. It tended to be a lot more common before. now that we have so many drugs available, is really not as common. But botulinum toxin injections are approved for sialorrhea, for the drooling, and there are now two botulinum toxin drugs approved for drooling in Parkinson's disease, Xeomin and Myoblock. The way this works is that you will have to be seen at one of the clinics that are trained to provide this treatment, and you get a consultation, and that consultation has to explain the need. Why is it that you need this? And once that consultation is completed, it is sent to the insurance for pre-approval. This is 100% covered by Medicare. So many patients with Parkinson's disease have Medicare, and it's one of the covered treatments for sialorrhea in Parkinson's disease. So once that is approved, which is usually 3 or 4 weeks, then you are able to get the injections right away. The procedure